Namaste, welcome to the class Hypertension Part 1. So today in this part I will be explaining about the classification of hypertension, role of halves, prevalence of hypertension and finally the tracking of blood pressure. So as all we know, hypertension is a non-communicable disease. It is a frequent worldwide health disorder and considered as an iceberg disease. Hypertension is a chronic condition of concern due to its role in the causation of coronary heart disease, stroke, and other vascular complications. Another importance is it is one of the major risk factor for cardiovascular mortality, which accounts for about 20 to 50% of all deaths. Next, coming to the classification of blood pressure measurements. So you have to by heart this chart where the optimal comes like systolic 120 less than 120 mmHg and diastolic less than 80 mmHg. The normal is 120 to 130 systolic and diastolic 80 to 84. Then comes the high normal grade 1, grade 2 and grade 3 hypertensions. And finally isolated systolic hypertension where the systolic comes like greater than or equal to 140 and diastolic less than 90 mmHg. One thing here to remember is when diastolic and systolic blood pressures fall in different categories, the higher category should be selected to identify the or classify the individual's blood pressure. For example, if once the systolic is 124 and diastolic is 82 mmHg and on the next time when he checked it is 140/90 mmHg, then he must comes under the category of grade 1 hypertension. Okay, so next is about the classification of hypertension. So it is divided into two, that is the primary or essential hypertension and the secondary hypertension. First one is primary or essential hypertension. Causes for essential hypertension are generally unknown. Okay, but it is most prevalent form of the hypertension, accounting for about 90% of all cases of hypertension. And that is, it is the primary one is the very common type of hypertension. Then comes the secondary hypertension. When some other diseases or abnormality is involved in its causation, for example, the diseases of kidney or tumors of adrenal glands or toxemias of pregnancy, all these are if related, if the person is having hypertension because of these reasons, so this type of hypertension can be classified under the secondary hypertension. Next is about the role of halves. It is very important for Viva as well as a short question. So just listen. Hypertension, as I already told, hypertension is an iceberg disease. Because when we consider a population, only half of the hypertensive subjects in that general population are aware of the condition. And among them, only half of them were being treated. And again, among those who are treated, only half were treated adequately. Okay, so in a general population, if there are 100 people, only half of them were aware about their condition or the hypertension, and only half of them were treated properly. Being treated means undergoing any medications or any lifestyle or diet changes, and among them only half of them were treated adequately, like by medicine or by lifestyle changes. They are normalizing the hypertension. Okay. Next is about the prevalence of hypertension. The global prevalence of hypertension in adults is around 30 to 40%. And hypertension becomes progressively more with advancing age, with the prevalence of greater than 60% in people aged above 60 years. So, uh, when the people are getting aged, they are more, uh, there are more chances for getting the uh, hypertension. This may be because as population age, they adopt more sedentary lifestyle and there are more chances for increasing their body weight. Like maybe because of their any disease, personal health issues, or maybe because of any some like arthritis, Parkinson's, the persons will be having more sedentary lifestyle and so they are more prone for the hypertension. So this shows the prevalence increases with age and increased body mass index. They are more tend to develop the hypertension. Next is the tracking of blood pressure, which is the last point in this session. So, if blood pressure levels of individuals were followed up over a period of years, from early childhood into their adult life, then those individuals whose blood pressures were initially high would probably continue in the same track as they grow older. In other words, low blood pressure levels tend to remain low and high levels tend to become higher as individual grow older. You can go through this image. If during their early period, if they are having a better blood pressure, that will remain during their age time also. Means during as the person grows older, the blood pressure also keeps the same track. So this phenomenon of persistence of rank order of blood pressure is called the tracking. Hope you understood. And the application of this tracking is this knowledge helps in identifying the children and adolescents at risk of developing hypertension at a future date. Okay. So that's about the part 1 hypertension. Thank you for listening. In the next part, I will be explaining the risk factors and prevention of hypertension, which will be uploaded very soon. Thank you.